Hey, I think let's go ahead and just get started, and people can join in as their schedule allows. I want to respect everyone's time this morning. I want to just welcome everyone. So for those, I think I know most of you, but Melissa Hovey, I'm the marketing director for Sheer Charlotte, and we were so thrilled when Novant, who is such a great partner for Sheer Charlotte and a friend of the nonprofit community, reached out and said, we would love to bring in an expert on the COVID-19, what's happening, the vaccination, and just share with you what the progress that's happening and be able to answer any questions we have. So Dr. Jerome Williams Jr. is joining us this morning, and I'll tell you just a little bit about him, and then he can present to you. But Dr. Jerome Williams Jr. is an interventional cardiologist and senior vice president of consumer engagement and corporate health for Novant Health. Born and raised in New York, Dr. Williams attended the City College of New York, earned his medical degree from New York University School of Medicine, and completed an internal medicine residency at Columbia University College of Physicians and Surgeons and cardiology fellowship at Yale University. He completed his MBA from Wake Forest University School of Business. Dr. Williams is an experienced physician executive with over 20 years of leadership experience as medical director of research, chairman and chief of cardiology, vice chairman for the Novant Health Accountable Care Organization, physician executive of Novant Health Value-Based Business Unit, and board member of Novant Health Medical Share Savings Program. As SVP of Consumer Engagement, Dr. Williams leads the overarching strategic development and design of social responsibility, community wellness, community benefit, community engagement, and partnerships for Novant Health. Through the lens of an experienced physician, executive leader with business acumen, Dr. Williams is focused on aligning both traditional and non-traditional partners to translate the needs of the community, specifically social deterrence of health and human services, into health strategic systems initiatives. Dr. Williams is also responsible for the strategic direction of Novant Health, corporate health, and family residency programs. In addition to his strategic leadership role as SVP, Dr. Williams serves as a physician leader on the Novant Health Equity Council and Novant CEO Growth and Strategy Council. Through the constellation of clinical and business activities, Dr. Williams strives to bring greater value to the patients and communities through collaboration across disciplines, creating alignment to enable growth and accountability for the clinical outcomes, social impact, and associated financial risks of the healthcare consumers for all communities. Over the years, Dr. Williams has served on a number of local board and committees. He was one of the founding members of the Carolinas Association for Community Health Equity and serves as co-chair of the Mecklenburg County COVID-19 Recovery and Renewal Task Force. Currently serves on the following boards of the Wake Forest School of Business Charlotte Executive, Charlotte Regional Alliance Foundation, One Charlotte Health Alliance, the Charlotte Community Health Clinic, and he also serves as the Robert Wood Johnson National Advisory Committee and the UNC Clinical Transitional Science Award External Advisory Board. So, wow, thank you for joining us. You are deeply qualified. Let me go ahead and pull up your slides and share that with.
Well, thank you. And as you're pulling that up, I'm happy to be invited to have this conversation. And I use the term conversation because this is not a lecture. This should be interactive and meet the needs of all on this call. What I've done is to just put together a small slide deck to really just introduce some of the COVID-19 vaccine concepts and strategies and tactics that we've deployed, and then just open it up for conversation. So I'm just going to probably go through this, take 15, 20 minutes, but really want to make sure this is interactive and answer the questions that all of you have. Next slide, please. So I put together really 10 things to know about the vaccine because over the last, I'd probably say 6 months, even before the vaccine came out, we kind of knew which questions were going to be asked about the vaccine. And so kind of grouping these into kind of 10 areas often will touch on the vast majority of the questions that folks have. And if I don't touch on those questions, then feel free to ask those questions. So first and foremost, just to throw it out there, we know the vaccine is safe and we know the vaccine is effective, right? Now we're going to build on how do we know that, okay? Uh, Most people will say, well, you developed this vaccine in 1 year, whereas historically vaccines take so much longer to develop. I will tell you that the development of this particular vaccine actually predated the release of the vaccine by at least a decade. So there's constant scientific discovery, scientific development, new tools that are developed that were used to accelerate the development of this particular vaccine. Probably more importantly than just the tools over the last decade that have been developed is that research and the research process and research clinical trials takes an enormous amount of money, And because the world was affected by COVID-19, governments pumped in tons of money into the research process, which accelerated this whole process. You can go back one slide, please. No, the other way. Okay. So when we talk about how quickly the vaccine was developed, I will say the analogy that I use that people take for granted, but it's the same thing in medical discovery, is updating your iPhone or whatever phone that you have every year or sometimes twice a year. There are updates, there's new technology, new advancements that's pushed out. There's no different in the scientific discovery as it relates to medicines. There's constant discovery on a regular basis. The only difference is that you don't usually hear about it, right? Why would you hear about it? The only reason that most folks are hearing about it now is because this is a pandemic, but we have scientific discovery on a daily basis that are used to develop the vaccine. Next slide, please. So when we look at the safety and the efficacy, we really have to go through how vaccines are developed. And I'll get to that in a couple of slides later on. But there's a process, a scientific research process that all medicinals have to go through in order to become approved, okay? It's a rigorous process. It's devoid of involvement from the sponsors. When I say sponsors, a company may do the manufacturing of the virus, of the vaccine. However, when it comes to evaluating it, there are separate data safety and monitoring boards that are separate from, completely separate from that process. So it's an independent process. And this was developed over the decades. Why? Because we want to make sure that the science behind it and the efficacy behind anything, not just vaccines, Tylenol, aspirin, any over-the-counter medicine, they must go through this process. Number 4, they are mRNA vaccines. So what does that mean? To make it very simple, the flu vaccine and other vaccines are often made from weakened live virus, okay, or they're actually dead virus, and they're often made or incubated, I should say, in eggs, okay. This is a different type of virus where it's not a live virus particle, and nor is it a weakened virus. It's the building blocks or the proteins that help us make the antibodies to this particular coating that's on the virus. So in short, to make it very simple, nothing that the COVID-19 virus vaccine, I keep saying virus, the COVID-19 vaccine has is alive. When you are inoculated with this vaccine, you're not getting any live virus, you're not getting any weakened virus, and you cannot get COVID from this particular vaccine. That's what makes it so unique and novel. When you receive the vaccine, this is basic high school biology, okay? It causes your body to produce antibodies to the receptors on the COVID-19 virus. And when those antibodies interact with those receptors, it essentially neutralizes the virus to reduce transmission and reduce the spread of the virus, and also reduce the significant symptoms and morbidity that can go along with it. Next slide, please. So this is the research and approval process when any, not just the vaccine, when any medicinal goes through a clinical trial. There's a phase 1, phase 2, and phase 3, okay? There are actually phases that occur before that are done in animals before they're introduced into humans, okay? And so phase 1 is, is it safe? Is it going to cause any significant reaction in a small cohort of individuals? And at what level or what concentration is most effective? So obviously, we would like to use the lowest concentration of any vaccine, any medicine that has the greatest efficacy. And so in phase 1, you'll have volunteers that may receive 3 different concentrations across the group, and to see the safety and effectiveness of it. Once they realize that the vaccine is effective and safe in a small group, then they open it up to a larger group of volunteers to really see what are the short-term and sometimes long-term side effects. And then the biggest phase, which is once again why I say trials are very expensive. When you have tens of thousands of individuals enrolled in trials, that is very, very expensive. And the reason this process was accelerated is because, as opposed to sponsors trying to find funds to run the trials, governments around the world supported these clinical trials. So this is the process not just the vaccines go through, but all medicinals go through. Next slide, please. This question often comes up and is very, very germane. When I was medical director of research, one of the challenges that we often had was a diverse group of individuals enrolled in clinical trials, which is very important. And there was a very intentional strategy with the Pfizer Moderna trials to bring in a very diverse cohort. Now, when you look at this graphic, about 35% of individuals or people of color. You may say, oh, that's not a lot. But when you look at historical trials where 1%, 2%, 5% were people of color, this is really an amazing undertaking and very intentional. Next slide, please. So let's go through the next 5 things to know about the vaccine. For the current Pfizer Moderna, okay, it requires 2 doses. The Pfizer 21 days apart and the Moderna 28 days apart. Now, I will tell you that Johnson & Johnson is at the cusp of getting approval for their vaccine, and their vaccine is a 1 dose or 1 shot type of vaccine, which then obviously changes a lot of the operational logistics in delivering a vaccine. There are no major side effects. When I say no major side effects, that's not to say you won't have a sore arm. That's not to say you may not have a fever, a low-grade fever, some achiness. When I received the vaccine, what occurred in me was a little arm soreness, and I was a little sleepy the next day. I couldn't actually figure out why. It was a Saturday, and I was kind of up and about, and boy, I just felt a little bit kind of tired. But by 48 hours, it was gone, and life was back to normal. Now, once again, this is no different from any other vaccine, right? Once again, because this is a pandemic and this has been in front and center for the last 12 months, um, folks will say, well, I had a sore arm, I had this, I had that. They're absolutely correct. But I would also say when you get the flu vaccine, there are often side effects that really most folks just don't talk about. Um, I already mentioned that the vaccine is made from messenger RNA, and so it's not a live or weakened virus. So you cannot get COVID from receiving the vaccine. Period. Point blank in the sentence. There's not any discussion. There's no but ifs or howevers. You cannot get the COVID-19 from this particular vaccine. Yes, it's free. Okay, now if you go to our website or any healthcare system's website, the CARES Act has dictated that we have to put the price of the vaccine and the price of testing on the website. But all insurance companies will cover it. And for those who don't have insurance, it's free. So the bottom line is you don't have to worry about, you or your constituents have to worry about the fact that, hey, I can't afford it. It's free for everyone. And the point of getting vaccinated is so that we create herd immunity. The whole purpose of gaining herd immunity is to reduce the spread across our communities and reduce the amount or the burden of virus in our community. Now, if we reduce the burden, it doesn't mean we completely eliminate it, but it becomes much more manageable, much more manageable, okay? And more importantly, with the variants that are coming up, the quicker we get the herd immunity, the more likely we are to suppress new variants and mutations that occur with this particular virus and other viruses as well. This is not anything new. Viruses mutate, all the time. Next slide, please. So I just want to talk a little bit about our equity vaccination strategy. And it's really important because there are communities that historically have not received equitable care for a variety of reasons. And we've known that for quite some time, even before COVID at Novant. And so when we realized that the vaccine sometime in early December was going to be released, we wanted to ensure that in addition to mass vaccination sites, that we also had a strategy for reaching historically excluded communities. And that strategy included strategically embedding vaccination sites in targeted communities. And how do you do that? You use pop-up sites in churches in partnership with faith leaders. Why? Because faith leaders are often trusted in communities. And if you partner with faith leaders, they are able to assist in communication as well as a sign up of individuals to be registered for receiving the vaccine. Local leaders of organizations, minority business leaders, etc. We also worked with our CMS school systems. Why? Because schools are deeply embedded in all communities, all communities. And so we specifically targeted communities in the crescent, right? So those zip codes that are considered public health priority zip codes. It's nice to have, and we also have drive-through mass vaccination sites, but what if you don't have a car? What if you have transportation insecurities? What if you just don't want to leave your community? And so we have to be very innovative, very strategic in terms of ensuring that all individuals have access to the vaccine. Next slide, please. So these are some of the schools and faith organizations that we've partnered with. Our Michael Jordan community access clinics, our movement school community access clinics, these are all in priority zip codes. Now, once again, as I said, this strategy that we deployed really predated COVID. When we're are working to achieve equity in other disease states, hypertension, diabetes, stroke management, okay, All of this work predated COVID-19, and we've leveraged those relationships now to use in the delivery of vaccines. As you can see, I just listed a few of the faith organizations at the bottom. And interestingly, right after this call, I have a big meeting with a bunch of other faith organizations to continue to drive vaccines through their partnerships. Now, it's not only utilizing church uh, assets or church properties to have these vaccine sites, it's also to leverage their parish nurses and their health ministers to register individuals. Because if you think about it, right, we're still in phase 2, 65 and older. We're going to head into phase 3. I don't know about you folks, but you know, folks that are 65 and over, they're not exactly on their social media. They're not exactly on email all the time. They're not exactly, on Instagram and looking at when the next site is going to pop up. So we have to be very innovative. And sometimes innovation means going back to the old pen and paper, right? So we leverage faith leaders and then parish nurses and their health ministers and say, hey, can you identify within your constituency those that meet the criteria? Here are the demographics that we need to get them registered. They will get that information, and along with our team members, we will input that information and get them registered. Sometimes that means using the phone, the old-fashioned phone, right, to get folks registered. Now, don't get me wrong, it's great to have a link, and we do have links, getvaccinated.org. If you go to getvaccinated.org, that puts you straight into our portal to give you all the information you need to get pre-registered. But it also is a barrier for some folks. So you just can't think about one way of reaching communities. You have to really partner with those in communities and listen to how best to reach certain groups of folks. Next slide, please. So this is just some of our health data and metrics as it relates to COVID-19. Since March, we've performed about 500,000 COVID tests, about 750,000 virtual visits, which exploded because of COVID and lack of access, direct access to the office. We've had at least 11,000 inpatients recovered. Unfortunately, and that's 91%, which is great, but unfortunately, 9% have succumbed to COVID-19. And many of you may know folks who've passed away from COVID. So yes, the disease is real, and we have to continue to fight back against this pandemic. We continue to do testing with our partners. Once again, we do things in partnership because it amplifies the impact of what we're doing, and hence the reason why we're having this call today, because you're all partners in this effort, and we all support each other so we can create a greater impact. Since mid-December, 97,000 vaccines administered. That's a lot of vaccines administered during that time. And I will tell you, I just have to give a shout out to our team. You know, they've been working really 7 days a week for really a year now. And I can't say enough about our medical staff, our frontline workers, housekeeping, all the folks at Novant that are really fighting back against this pandemic. Next slide, please. Now, this is a really important slide because this shows that the intentional strategy of not just only focusing on big mass events, and we've had mass events at the Park Expo where we've done 4,000 to 5,000 in our hospital at Forsyth. We have a Sears, an old Sears building that we own. We drive 5,000 individuals through those sites at a time. The Spectrum Center this past weekend, close to 2,500. However, we have the smaller pop-up sites at churches, at our Michael Jordan clinic, or our mobile units at the Movement Mortgage Clinic. And as you can see, when you have these smaller community events, the African American population, we're able to vaccinate at a higher rate than the county, the state, and even across America. Now, data is very important because we have a lot of work to do with our Asian and our Latinx populations. But when I say that's okay, it's okay because we have the data. Now we know we have to partner more deeply with our Latin coalition, with El Camino and other Latin organizations and leaders. We have to partner more with our Asian leaders and our Asian partners in the community to get those numbers to where they need to be. So it's very important to have data so you understand where the potential gaps are. Next slide. Same thing for Forsyth County. It's similar to Mecklenburg County. When we have our targeted events, you can see where we have partnerships with leaders and faith-based leaders, especially in minority neighborhoods. The registration and vaccination rate is much, much higher. Next slide, please. So this slide really just depicts the fact that our healthcare workers, Black, brown, Asian, white, we all believe in the vaccine. And I often tell folks when there's some vaccine deliberation, I don't like to use the word vaccine hesitancy because it puts the onus on the individual that they're hesitant, but they're really not hesitant. They're deliberating, trying to understand. That's why we're having this webinar today. This is just to depict the fact that, hey, we're receiving the vaccine. We believe in the vaccine. We know it's safe, we know it's effective, and we know that by receiving the vaccine, we're stopping the transmission and also healing our communities. I believe that's our last slide. Let's see if there's one more slide. Yes, so this is just information on where to get information on the vaccine and how to register, frequently asked questions and things of that nature. Getvaccinated.org. All the information is right there, not only your FAQs, but also how to get registered to receive a vaccine. You don't have to be a Novant patient. You don't have to have a Novant physician. We're in partnership, as I say, we're in partnership with the county. We're in partnership with Atrium because the goal is to really vaccinate the whole community because we're better off as a community if we're all vaccinated. And then lastly, even though we have the vaccine, we must still remember that we have to practice social distancing, excuse me. We have to continue to wear a mask, and we have to continue to have hand hygiene, wash your hands, don't touch your face, things of that nature. So just because we have the vaccine at this point in time does not eliminate the need to continue to do the things that we know work. To be quite honest with you, if this was instituted in a mandatory, or I wouldn't even use the word mandatory, if this was instituted at the highest level back in March, we would not be where we are today, point blank in the conversation. It's free. Masks are free, right? Social distancing is free. Hand hygiene is free, but highly effective, folks. I cannot underscore that. If we all bought into this early on, our businesses would be open, our schools would be open, and I would be sitting in a room having direct conversations with all of you and not on a Zoom meeting. So I'll stop right there because I want to leave plenty of time for questions, thoughts, feedback, and dialogue.
Thank you so much. That was really, really great. I think because we've got such a nice small group, I think if you've got a question, feel free to take yourself off mute and ask away.
Hey, Dr. Williams, this is Lindsay. So I guess full disclosure, I work at Novant Health, but I was curious, as you guys continue to expand sites around the community, I love that list you had with some of the future partner sites. Do you foresee a need of more community volunteers? I know there was some opportunities recently, but you know, for some of the organizations that are on this call, do you think there will be a need for community volunteers to help serve at some of these sites?
So the short answer is yes. We actually have a point person for our volunteers, Melissa Parker. However, you can reach out to Lindsay or myself, and we can get folks connected. We have a process for that because we want to make sure our volunteers are trained. We have a training program. When I say training program, it's not intensive, but there's certain things that we want to ensure so that folks know what to do when they're at particular sites, and it's site specific. Often we will have volunteers based on the site. So, for example, when we're at the Park Expo, excuse me, the church had a bunch of volunteers that they wanted to use because it was their particular church, and they just felt the need to volunteer. And so we definitely welcome volunteers. Absolutely.
Dr. Was that a question? The variants we're hearing about, what, should we be concerned, or is this just a natural mutation of the way a virus works?
Right. So I'd like to keep things very simple. Now, in the scientific community, in the epidemiologic community, in the infectious disease community, yes, there are concerns about the easier transmission of the particular virus and some of these variants. However, there are always variants in viruses, always. This once again just happens to be front and center because we're in the middle of a pandemic and now everybody's focused on it. But if you think about the flu shot, every year you have to get a flu shot. Why is that? Because there are different variants that occur that you need to be vaccinated against. Now, what does that mean for the lay community? I go back to wear a mask, wash your hands, wait 6 feet apart. If we follow those, then the variant, and then now the fourth one is get vaccinated when it's your turn, because the quicker we get to herd immunity, the more likely we are to suppress variants.
Got it. That's very.
But for the lay community, let's keep it real simple. If we do those things that we know work, then we don't have to worry about the variants.
Dr. Williams, to me, this seems like a no-brainer, but you hear, and maybe it's not truth, that a lot of physicians or a lot of medical providers do not want to have the vaccination. And maybe that's erroneous, but is that true? And if so, why, if the science is there and this is really just another vaccine for to eliminate or to reduce the risk of COVID?
So I won't say it's erroneous, but I will also say that it's not as pervasive as one might hear, one might think. Once again, everything is amplified with COVID because this is now front and center, right? In everybody's eyes, right? No one ever spoke about virus until last year, right? I do think that you have segments of society, right? So some healthcare workers, they are part of society as well, right? And so they often are influenced outside of scientific norms, which is at times, I'll say, bothersome from my perspective, by rumors and innuendos and things of that nature. But I do think, Libby, that it is probably more amplified because it's in the media than one, and depending on which media you subscribe to, it is much more amplified than it really is.
Thank you.
All right. Well, I have another question. I don't know if you have a crystal ball, but I think phase 3 is when a lot more of us in the community, maybe under 65, could get vaccinated. Is the summer still realistic? Could it be sooner? Could it be later? I don't know if you have an estimation.
So it really is all about vaccine availability. That's what it's all about. We're scaled and have infrastructure to do 95,000 vaccinations a week. But when you're allotted 5,000, 10,000 a week because of the allocation process because of lack of vaccines, that becomes a challenge. I do think the summer is still realistic. I do think so. It was announced about a week or so ago that there will be upwards of 200 million more doses of vaccines provided. Now, that said, we have real life challenges, right? The weather. So a number of healthcare systems, including ours, have been affected by the weather because Pfizer can't ship vaccines because of inclement weather in the Northeast, or it was delayed by a day or two. So we still have to deal with real world, logistical issues. But the short answer, Melissa, is I believe we are on track for the summer, but it's really about the amount of vaccines that we have to be able to deliver. With Johnson & Johnson hopefully coming online soon, that's yet another manufacturer that increases the pool of vaccines available, and that would be very, very beneficial.
Dr. Williams, I have a question. Oh, sorry, go ahead.
No, that's okay, Kara. I just want to finish up with Melissa. It's really a supply demand issue right now. And so even though we're going to phase 3, if the supply is not there, demand is high. We have a huge wait list. The demand is high. If the supply is not there, it's still a barrier that we have to overcome. I'm sorry, Kara.
No problem. I'm the communications director for Charlotte Family Housing, and I was really heartened earlier this week when Isaac Oyer of the community relations team sent us a note, and I'm sure he blasted it to a lot of nonprofits about, hey, we've got an event on Thursday, please share this with your constituents, et cetera. And so my question to you, Dr. Williams, is as we move forward, especially as we're in a phase where, to your point, some of our seniors might not have the bandwidth or the wherewithal or the technology to get to where they need to be, whether that's transportation, the device to register, et cetera. What can we do as a nonprofit community, and I'm sure Cher would love to be the glue of this, to help more so that we can move forward? Once vaccines become available, we can make sure that we're reaching the levels of that we want. How can we help?
That's a brilliant question, and I have an answer for you because we've been doing this with some of our partners already. If you can begin to build your list of those individuals who hopefully they want to be vaccinated, okay? And when I say build your list, name, date of birth, a contact number, whether it be a cell phone, landline, or what have you. And if they have an email, that would be great as well, okay? So that if there's an opportunity, as Isaac mentioned, and we have a mass vaccination, then we can go to Kara, we can go to Melissa, we can go to others on the call and say, hey, we're going to do a pop-up event this coming Saturday, or we're bringing a mobile unit to your site. Can you help us identify those, especially older folks that have not been vaccinated, that want to be vaccinated, that have not had the opportunity to either register or whatever the case may be? Then that list becomes invaluable because it's already established, and our team can then work to get those individuals registered and into the system. So we encourage folks to begin to build their list now. That was a great question, and thank you, because it's through these partnerships that really will help get the community vaccinated. These are folks that trust you, right? They trust you. They lean on you, and we leaning on, and as such, I'm as head of community engagement are leaning on you guys to help us partner and to create a greater impact. Thank you.
Perfect. Sorry, I have another question. I'm filled with them. fascinating. So kind of back to if the summer does work out,
Mhm.
there a time frame? Is it 6 months, 12 months where we could be in person again? You know, our nonprofit community likes to get together in person or hold events. Any thoughts on the time frame around when that could happen?
So it really would depend on the event, right? What do I mean depend on the event? If it's an outdoor event, right, and folks are still practicing, you know, some masking, right, because you still want to practice that, and it's an outdoor event, an open area, park, things of that nature, I think that would be fine. Um, if you're talking about an indoor event where folks are kind of elbow to elbow,
Mhm.
that makes it a little bit more challenging, definitely a little bit more challenging. But I'm hopeful by the fall, we would have some type of ability to have some indoor event. And I would say with continued masking, because we really want to tamp this down.
Got it. No, that's helpful.
Hey, Linda, haven't seen you in a while.
Nice to see you, Dr.
Good to
Williams.
see you.
Thank you for doing this. Very,
My
very
pleasure.
helpful.
My pleasure.
I have another follow-up question. Do you worry all about future pandemics?
Yes,
Okay.
yes, absolutely. I think that we were worried about this years ago.
Mm.
We had a number of trial runs and stress tests over the last decade. They were smaller, but nonetheless, we had trial runs. H1N1, Ebola. I always forget the third one.
SARS or
Thank you.
sorry.
Thank you. Thank you. Sorry. I always forget the third one. And as a result of that, during the Obama administration, they put together a task force to understand our readiness for that. It was a comprehensive supply chain, I mean, all of it, okay? Unfortunately, that playbook was kind of tossed out, okay? Scientists knew this was the possibility. People talked about it. Bill Gates talked about it, that the biggest threat to society, when I say society, global society, wasn't nuclear war, it's a pandemic. And we were being tested all along the way. And so I do, you know, I'm not trying to be a, you know, fear monger or anything like that, but I'm a scientist, and you have to, you know, follow the science. And so, you know, I'm hopeful that it will not be on the level of a pandemic, right? But the reality is that we've seen this once again over the years. Once again, for the lay public, this is somewhat new. But if you look back over the last decade, you know, Ebola was a big deal. It's just that it didn't really hit us here, right? We had a couple of people, they were isolated I think it was in Atlanta in the CDC, and they were cared for, you know, maybe 2 or 3 people, and it was really tamped down, okay? But it was really, you know, if you look at Africa, right? Go look back in the newspapers, international, it was a big deal. You know, SARS, right, was a big deal. It just didn't hit us over here directly. And so it was not really, it really didn't bubble up to the consciousness of the lay public. So I'm hopeful that once again, we've learned, you know, we should learn from each lesson, and therefore become better prepared.
No, thank you. Yeah, I think we've all learned very valuable lessons throughout this. Awesome.
And we have to understand, I'm just going to give my, it's not an editorial, We have to understand that we're all in this together. This is not politicized. This is not politicized. The virus, they are attacking young, old, black, white, Republican, Democrat, rich, poor, it doesn't matter. It doesn't discern. And so we have to understand this is not a political situation. This is a health situation and economic situation, educational situation. I'm worried about our students. I'm worried about our children. I'm worried about businesses. I'm worried about the economy. It started with a virus, but is affected, it has a ripple effect. You know, we're social beings. I'll speak for myself. I'm an extrovert and I miss being in contact with folks, you know. So I just wanted to just throw that out there. You know, this is not a political thing. This is a health thing. And I'm a firm believer that there are two foundational elements that propel societies forward. Educated society, and you can define education in many different ways, but an educated society and a healthy society. I don't care what religion, I don't care what race, I don't care what ethnicity, what nationality. If you're an educated society and a healthy society, those are the societies that typically move forward. It's not a political thing, right? Just think about it. If you're unhealthy, you can't contribute to society. If you're not educated, or the society as a whole is not educated, you can't really contribute to that society. Once, I don't care what religion or ethnicity or nationality, it doesn't matter. It cuts across all. And so what we're talking about right now is the health of our society. And we can see the ripple effects that has occurred because of the pandemic.
Absolutely.
I do have one quick question. First of all, thank you so much for sharing all this. It's been so educational, but also things I felt like I already knew, you've just substantiated. So thank you for that. And along those lines, if I have family members or friends who do have some concern about the virus, is there anywhere where I can point them that has some of this exact same information? Because this just is really great to know.
So I'm going to broaden that. A great question, Nicole, and I'm going to broaden that a little bit too. You often have to meet people where they are, right? You have to meet people where they are. I don't. My position is, I don't beat folks over the head, right? I try to meet them and understand what concerns they may have, all right, and then address them specifically to that individual or the group of individuals, and not broadly. I would and will say that the getvaccinated.org site has a lot of information. I'd also say the CDC is a good source of direct, scientific, honest information.
Okay.
You know, the CDC was somewhat politicized over the last year, which is unfortunate because that is the preeminent institution in the world as it relates to this pandemic. But the CDC is still the preeminent institution in the world when it comes to this. And so I would point them toward either getvaccinated.org and or the CDC website. And once again, I'm very sensitive that, you know, you need to meet people where they are. There's a lot of reasons that folks have concerns, and they're real concerns, and they should be addressed appropriately. I just want folks to be go to a correct source of information. I was on a webinar last night with Congresswoman Alma Adams, and a question similar to yours, Nicole, came up. And I said, you know, once again, I try to keep things very simple and not too scientific. And I say, if you've trusted your doctor since you're a child, as a pediatric patient, if you trusted your OBGYN, if you trusted your cardiologist who got you through your heart attack, and the list goes on and on and on, why would you not trust them now? Your OBGYN didn't send you in the wrong direction when you delivered your baby. Your pediatrician didn't send you in the wrong direction when it's time for the routine vaccinations, measles, mumps, rubella, et cetera, et cetera. You know, science is not perfect, but for all the guardrails, checks and balances, and processes that are put in place for the scientific method is as close to perfect that you will get in society that, you know, is led by humans, right?
Yeah, no, that makes complete sense. And I appreciate you putting it that way. It's not a way I would have thought to frame it, but it makes so much sense.
All right. All right. Well, I think there's not any other questions. We so appreciate the time. I think everyone's benefited tremendously, and we just so appreciate Novant Health. And truly, you guys are your workers are, you know, just doing such an amazing work in our community. We just are so thankful for you. And we at Share Charlotte, is a convener of the nonprofit community, are here to support all your work and to get any information out and convene people where it's needed. So please use us as a resource.
Well, I appreciate the thanks, but actually I thank all of you, because all of you, you know, we're an anchor institution, and as an anchor institution, my point of view is that we have to create a platform for partnerships. You know, we can't do it all. And so I thank all of you for your engagement, because it really helps drive information forward deep into the communities that you serve. And without you leaders on the call here, really interested in this and really trying to help your communities, we would be nowhere. So I actually am going to throw it back at you, Melissa, and thank all of you. And I appreciate it, but you have no idea the impact that maybe you do, but from my standpoint, and Lindsay and Robbie understand this, I'm about a partnership kind of leader, because it's not about recreating the wheel. It's about leveraging the intellect that's on this call here, leveraging the leadership on this call here to amplify the effects across the community. So I just want to say thank you to all of you.
Awesome. Thank you so much. Thank you, everyone. Go out, wear your masks, stay socially distant, and we look forward to getting the vaccine when it's available. So thank you all so much. Have a wonderful Wednesday.
Have a great day.
Thank you. Appreciate it.
Thank you.